Nice to see all of you. Uh, if you want to introduce yourselves in the chat, that would be great. We would love to hear your name, where you're from, if you're connected to a university, what university you're with. Please go ahead and introduce yourselves and say hi in the chat while we wait for others to join us. We'll give it just another minute or so, and then we'll get started. Oh, I see Samia from Pakistan is here. Lydia from University of Valencia. Suwa from Nigeria, University of Jos in Nigeria. Oh, it's so great to see everyone. Oh, we just had a lot of people join from the waiting room, so welcome. We're introducing ourselves and saying hello in the chat. So if you want to say who you are and where you're from, if you're connected to a university, which university you're with, that would be great. And then I think we'll go ahead and get started. My name is Lori Crum. I am the director for the Center for Systems Change and the International Consortium for Universities for Drug Demand Reduction. And I will be your MC today. And I would first like to thank you all for joining us for this important webinar. It's really our first virtual webinar for all of our membership all over the world and our allies. So folks who are very connected to ICUDDR, who support our mission, and who want to learn more about our organization. So welcome everyone. We're going to start off with some welcome remarks from our executive director, Dr. Kevin Mulvey. Kevin, I'll turn it over to you.
Thanks, Laurie. Good morning, everyone. And it really is great to see so many folks and so many names that I recognize. And I wish we could all be together, but it's great to have us here together virtually. I really want to mention that in this meeting and going forward, but it's always been this way, that we're a member organization. And so this organization is yours. It's not just the folks that are staffing it. And we really are looking to more greater involvement of the membership. Just by a quick introduction of ICUDDR, we have approximately about 477 universities. We have individual members, which include an additional 300 and about approximately 380. And these are spread across 99 countries globally. In ICUDDR, we have 4 centers, 4 areas of focus, if you want to call them. One is the education component, the webinars, the activities we try to work with universities specifically on curriculum, infusion, et cetera. We also have the Center for Research, where we had some funding at one point from NIDA a while back that we used to do some mini grants. We have the Center for Systems Change, of which a number of the folks on the call are members of the ITTCs, International Technology Transfer Centers, which sits in the Center for Systems Change. And we have the Center for Credentialing and Accreditation. So Laurie Crum is the acting director for the research and the director of the Systems Change. Carmel Clancy, who will be coming along shortly, is the director of the Center for Education for now, as well as the Center for Credentialing. We're actually 3 of us are sharing the Center for Credentialing component. We also have clearly an operational function and component. And many of you, if you've come to any of our conferences, know Diana Motel, who's on the call as well. Again, I just want to iterate, in these times, ICUDDR is still committed to our mission of infusing and working with universities, to infusing and working with the required policymakers that might be necessary to help make some changes in local context in terms of countries, whether we're talking about harm reduction, prevention, treatment, or recovery support. We really do, and I believe across all of those 4 areas of focus, we really do see that we want the world to be a better place for folks who have or might be at risk for substance use. We really want to see folks able to access quality treatment, evidence-based treatment. We want folks to be able to, if they're in some level or some area of that continuum, if you will, whether you think of the continuum as a circle or a straight line, we want folks to get into recovery if that's where they need to be, into treatment if that's where they need to be. And as we know, there are various types of prevention programs, universal, selected, indicated, if you use those terms, primary, secondary, tertiary, if you're old like me and you use those terms. And harm reduction is one element of that. Again, looking at harm reduction as a conduit or an avenue to services. With that, I'd like to again reiterate that this is your organization. For our allies on the call, and I see many of them, and I'm very happy that they're here. We need you as well. This cannot be done by a small team of folks. To really make the difference we're all looking to make within our own host country or in our own host university or program or partner organization. With that, I'm just going to say welcome to this important discussion on how ICUDDR is not just going to continue, but is going to thrive. And I love the theme of this conference or this meeting today. Together we will thrive. And it really is about us working together. So Laurie, I'm going to turn it back to you.
Thank you, Kevin. Thank you for that warm introduction and a reminder of how important the work we do is to global drug demand reduction. The work you do matters. We so appreciate you for everything you do. I'm going to share a little bit about the status of ICUDDR today. As many of you know, the US government recently announced a freeze on certain types of foreign assistance funding, which directly impacts organizations like ICUDDR that rely on these funds for international capacity building efforts. The freeze from the US government is broad and it affects multiple sectors, including public health, education, and development work. For us at ICUDDR, this freeze has had an immediate effect. We are experiencing delays in expected funding, particularly for initiatives supporting international partners and training programs. Some of our planned projects have been put on hold and may need to be restructured to align with available resources. Current obligations and existing projects are being reviewed to ensure continuity where possible with the limited funds that we have remaining. The long-term consequences of this freeze for ICUDDR are challenging. If the freeze continues, the availability of new grants and support for international partners could be significantly reduced. There may be a shift in our funding priorities potentially requiring ICUDDR and our partners to adapt to new sources of financial support. And long-term sustainability planning is now more critical than ever. We really need to look at how do we make sure that we develop a strong base of support for ICUDDR so that we can thrive into the future. We are working very hard to make that a reality. We have taken a number of steps to mitigate this freeze in our funding. We have been working to look at how we diversify our funding streams. We are actively pursuing alternative funding sources, including private foundations, multilateral agencies, and corporate partnerships. We are advocating in as many places as we can to engage policymakers, funders, and global partners to communicate the value of the work that we do and explore opportunities for continued investment. Of course, we have made internal budget adjustments. We're reviewing our priorities to ensure that core operations and essential initiatives remain stable, and we are very diligently working at how we can run a lean organization with efficient and cost-effective processes. And then, of course, we're strengthening network collaboration. So one of those activities is this webinar today. We want you, again, to feel like ICUDDR is your organization and that you have a stake in the survival of the organization. So we're encouraging you to explore co-funded projects. If you are applying for grants and funding and you see a role that ICUDDR can play in helping you, for example, disseminate your findings or partner with you in other ways, help you find collaborators across the network or within your region, then please reach out to us because we want to work with you and make your application stronger because, again, together we thrive. So ICUDDR remains committed to supporting all of you and will continue to provide updates to you as our situation evolves with the funding freeze. And we welcome input from any of our members or allies on potential funding opportunities or partnership strategies that can help sustain and grow our collective impact. So again, we just want to continue to involve our members in our work. And so with that, I'd like to invite some of our members to talk about how ICUDDR has impacted you and your efforts. And so first, I would like to invite Mr. Samuel Dakwak to join us and talk to us a little bit about how membership in ICUDDR has impacted you. Samuel?
Thank you very much. Kindly grant me the permission so that I can share a little slide.
Certainly.
Thank you.
Okay, let's see. I think, Taylor, you might need to do that as host. Oh, Verna is host. Verna, are you able to do that?
Yes, Sam, I think you have permission now.
Okay, thank you very much. I think I can do that now. I believe my screen is live now.
Yes, that's correct.
Okay, my name is Samuel Joseph Dakwak. I'm a lecturer with the Department of Psychology, University of Jos, Nigeria in West Africa. I would like to just take a minute or two to just share about the success stories and how ICUDDR has positively impacted on my life as an individual, my own organization, my university community, and then the communities around me, my region. So basically, my journey with ICUDDR began with individual membership, where I've had to register and I joined the international community. My institution has actually joined, is also a member of the ICUDDR. That's the University of Jos. We've been on for about 3 years now. In terms of personal development, permit me to share a few statements that would actually give you idea and maybe give some inspiration for someone how ICUDDR has inspired me by many programs and my participations and involvement in the events of ICUDDR over the years. In terms of personal development, despite my training in mental health as a clinical psychologist, I have had to develop my skills over the years, and ICUDDR has actually done a great work by helping me to improve in my competence and skills by the many activities and events which I will share going forward. In terms of the institutional development, my university is domiciled somewhere around the middle belt of the country and occupies a strategic location. It's one of the early universities in the country and has very strong and reputable name. And because of that, the work we've done and we partnered with colleagues we have many members of ICUDDR, individual members of ICUDDR here, and we've actually been doing so much. And our interaction, our activity with ICUDDR has actually made us to become very more innovative towards substance use prevention, such that we have had an innovative work at the University Psychological Services Center, where I work. We work together with fellow psychiatrists, social workers, psychologists, and all. And we've come up with an approach called the Direct Access Knowledge Service, where lecturers are able to quickly, taking them on trainings which we have received, they are able to identify students within the campus that have challenges, and then quickly we are able to do immediate intervention, brief intervention, and then necessary referral. And engaged in a lot of activities and participated in a lot of activities. Notwithstanding, we've had a lot of collaboration just because we've actually participated in ICUDDR activity through a lot of collaboration and networking with organizations such as the African Institute for Behavioral and Social Development. Is an African brand. The website is there, afric.org. We have other local organizations like Serenity and Wellbeing. We have GIZA, the Global Initiative on Substance Use, Quintessential Healthcare Center, and many others around my client here. So basically, when I look at my participation in activities, it is very inspiring because there have been a lot of webinars, series of webinars. As you can see, I decided to just flaunt just one of the certificates I got from the webinars we've had in 2022. And there were online courses, walkthrough. We've had the drug demand course development for universities, the walkthrough. We've also had other webinars and a lot of trainings that I can proudly say I have participated, I have learned, I have gained knowledge, and it is quite useful to me. And some of the certificates you can see here, I decided to share for someone to see. This is the walkthrough certification which I got because I participated in the Universal Treatment Curriculum Series walkthrough, although I have actually undergone such trainings, but the retraining was a bomb by ICUDDR. And then we've had a lot of conference and travel support. Personally, I've had the opportunity to travel down to Abu Dhabi in UAE, at Chiang Mai in Thailand. So as you can see, right, this was in Abu Dhabi, UAE. The conference was in 2022, and then 2022. Yes, this is still 2022. And I can see Diana was there, Kelvin and everyone was there. So these are my African colleagues, and it was at this forum that I was tasked with the responsibility to set up the WhatsApp group for the African region. We have Dr. Beatrice, Professor Moses Audu, Professor Rihanna, I have Farida, and all colleagues, they are there. So this was Abu Dhabi. So thanks to ICUDDR, gave me the opportunity to be able to network, to showcase our research at the international community, as well as other conferences. So just finally, to just see some of the other conferences that we've actually have attended. So this is Chiang Mai, Thailand. The conference, I can see boldly, Dr. Kevin is there, Dr. Beatrice is there. So at the connection, but we are trying to talk about how ICUDDR has actually helped us to connect with others, especially in the African region. Without ICUDDR, we are limited. You can see the smiles and the happiness on the faces of the some of our colleagues from the African region. I can tell you this is Dr. Martin, who is the African Deputy Coordinator in Africa. We were very happy and delighted when we met at the airport and so on. Just as a proof to anyone who cares to see, this was my tag, number 120, and this was my certificate of attendance at the conference. So just to mention that these are some of the activities we've actually had. But without taking time, I just want to round up by saying that ICUDDR Global has inspired us in Africa to actually come up with a maiden edition of our conference here in Nigeria, which we hosted last year. So we actually had the virtual conference and it took place. It was wonderful. Kevin attended. The pictures and the evidence are there. You can see Carly smiling. Caleb was there. Everyone was there. So finally, amidst all of this that I've showcased, looking into the future with ICUDDR as an individual and from my university, we look at the opportunity for regional conference, which we look forward to next month in Cairo. We are still trying to see how we can navigate, despite all the funding challenges from ICUDDR funders. We together, I had this meeting with Rania yesterday on seeing how we can mobilize local support to be able to attend the conferences. It is a regional conference for our African people here, so we can be able to share, collaborate, and see how we can be able to enhance the work of prevention across the world. Then we also look at opportunities for collaboration and partnership with universities and educational providers. And one such that we actually begin to do a lot of work is the African Institute for Behavior and Social Development, which actually looks at components of drug demand reduction, prevention, and treatment. Of course, we cannot wait but continue to enjoy and benefit from webinars and online courses, educational advancements, support, scholarship, and global credentialing. I, as an individual, since ICUDDR took over the global credentialing, I can bet that I am preparing to take my ICAP 3 exam in the next few days. So thanks to ICUDDR, my journey with ICUDDR has been wonderful, and I can only leave you to imagine if anyone had the opportunity and they did not utilize it. Thank you very much.
Thank you so much, Samuel, for sharing your experience and highlighting the impact ICUDDR has had on your work. It's inspiring to hear how our network is supporting real change, and your story reinforces the value of collaboration in advancing substance use education and training. So we appreciate your time and your insights. And now I'd like to invite Ms. Kalsoom Yasin to share her experience with ICUDDR. Kalsoom?
Hello,
Hello.
I am audible. Hello, I am audible.
Yes.
Yes, you are.
I am Kalsoom Yasin from Lahore, Pakistan. I am a PhD candidate. Currently, I am working as a research and development officer, also practicing as a psychologist with the different rehab centers and working for other different projects. ICUDDR has played a major role in my career, transformed me on a higher level. Uh, Last year, it gave me an opportunity to travel and attend the conference in Greece. Also, I am thankful for the free webinar, workshops, and trainings, which are free to use, uh, and we can attend and gain expertise in clinical practice, research skills, and in professional growth. Uh, these are free opportunities for Pakistan, uh, where such no opportunities exist. So ICUDDR is playing an incredible role for such professionals from low-income countries. So I am supporting for that.
Thank you, Kalsoom. Thank you for sharing your experience and insights. It's wonderful to hear how ICUDDR's webinars and conferences have helped expand your professional knowledge in clinical research. Your journey is a great example of how learning opportunities within our network can support growth and strengthen the field. So we appreciate your time and contribution.
Thank
And
you
we have just a few more minutes. If there's anyone else who is on the webinar who has been impacted or had success in their professional growth through ICUDDR, we would love to hear from you as well. So I know there are some ITTCs on the call. I know there's some advisory board members. If there's anyone else who would like to share how ICUDDR has impacted you, please unmute or raise your hand, and we'd love to hear from you. We'd also welcome you sharing in the chat. Don't be shy. Now, those of you who know me, you know that I was formerly a high school teacher, so I will call on you. Samia Aftar, and I apologize if I am mispronouncing your name, but you have your hand raised. Would you like to share?
Hi, everyone.
Hello.
So, in a part of ICUDDR conference in 2018, and there was the time when I was teaching in 3 different universities in Pakistan. Although at that time I wasn't able to bring those universities on board with ICUDDR, but actually that conference made a great impact on my own conduct with my students. So although there was not formal, but informally, at informal settings and informal settings, I started teaching my students about the SUDs and the prevention and the psychoactive substances and all that stuff. And I think that in that conference, ICUDDR actually supported me, my stay there and my expenses. And I think that was the best thing that happened to me in 2018, because after that, in my university teaching experience, I came across to many students, and they were so excited to learn about all these things. And many of them then went to the treatment centers as well. So I think ICUDDR is doing a great job under the guidance of Dr. Kevin. I know him personally. He's a wonderful person. He's a great leader. And I'm sure that under his leadership, we are going to go through this difficult time together. And I suggest that although it's a difficult time, but still we can find ways to work through this, and we can always find solutions where we can still continue contributing in our capacity in our societies. And I'm sure that we all are very, very creative people. So thank you, ICUDDR, and thank you, Dr. Kevin, and thank you for arranging this meetup, because yes, I think whenever we sit together and brainstorm on something, we always bring up something positive. So thank you so much.
Thank
Oh,
you.
thank
Samia.
you so much. Go ahead, Kevin.
No, I was just thanking Samia.
Thank you so much for sharing. We appreciate that. I think we have time for one more. If there's anyone else who would like to share their experience with ICUDDR. Okay, well, we do encourage you to continue sharing in the chat. Oh, Samuel, do you have one more thing to add?
Yes, please. I would want to share my discourse with the ICUDDR Africa, West Africa coordinator in the person of Professor Moses Audu, and what Professor Michael Ezenwa, who is the African chapter chair, they have both promised to be online to share their own experience. But collectively, I would want to share that one of the inspiration that we've drawn from ICUDDR, I remember the great work that Calvin did to be able to help us to set up departments of addiction sciences. So currently in Nigeria, because of the efforts of ICUDDR, we'll be able to get a couple of universities, about 4 universities now offer addiction science in Nigeria, in addition to all the sponsorship, the good sponsorship that we have enjoyed from ICUDDR to participate and to contribute on the knowledge of our region here for the global community. So I would want to just share on their behalf that thanks to ICUDDR, we have a couple of universities in Nigeria that offer additional science courses. Thank you, and well done to the wonderful team. Together, I believe we will all pull through this. Thank you.
Thank you so much for providing that additional context, and congratulations to the universities in Nigeria for the excellent work in integrating substance use curriculum into your academic programs. Now I think we'll shift gears, but do continue to please introduce yourselves and share your experiences in the chat. I'm going to turn it over now to Miss, soon to be Dr. Verna Felipe, to talk a little bit more about the impact that ICUDDR has had.
Thanks, Laurie. Let me just share my screen. And let's do, oops. A slideshow. Okay, can you see it now?
It looks
Great.
great.
As our colleagues mentioned, so thank you very much for being here. We appreciate your presence. So we have sharing about how ICDDR has impacted some of our colleagues, but to give you a bigger picture of what we are doing or what we have done, in the past year, allow me to share some key accomplishments, I would say, that we have. So, okay, so let me start first with acknowledging our growth. And this is possible because of all of you. So, since the formal inception of ICUDDR in 2018, so we actually are continue to increase the number of members. So we have about 473 institutional members from 99 countries, in addition to 792 individual members from 62 countries. And we expect this number to continue to increase with the addition of student membership. So, and it's only made possible because of you, our dear members. And I'm sure that my colleagues will share with you in the chat other ways to join so that you can actually, I have seen interest on people how to introduce the organization in your country. Please share them the link so that they can apply for membership. So aside from the growth in terms of number of members, we also we practice integrity in the organization. So we always advocate for networking and collaboration, and we ourselves are actually seeking active engagement with other organizations, including ISAM, the International Society of Addiction Medicine, International Nurses Society on Addiction, Organization of American State Inter-American Drug Abuse Control Commission, normally known as OAS-CICAD in their Spanish formal name, the Foundation for Drug Policy Solutions, ISAP, which I'm sure you all are familiar with, the National Institute of Drug Abuse. As Kevin mentioned, we receive a small grant that allows us to support people in their pursuit of, like, especially emerging professionals in their pursuit of scientific knowledge in terms of conferences and research presentation. We also have existing partnership with the University of Wisconsin, as well as African Union and Columbia Plan, to name a few. So now let's talk about credentialing. Samuel mentioned about credentialing. So in the past year, so this is the past year achievement. So basically, the Center for Credentialing conducted examinations in 4 continents. So basically, they did one in North America, South America, Africa, and Asia. So there were 19 countries that benefited from credentialing, including Afghanistan, Bahamas, Bangladesh, Brazil, Ghana, India, Indonesia, Jordan, Kenya, Liberia, Maldives, Nigeria, Pakistan, Philippines, Qatar, South Africa, United Arab Emirates, Vietnam, and Zimbabwe. So in this chart, you will be able to see the number of people who took the examination as well as the number of awarded credentials, meaning those who passed. So there are 2 ways to be able to take the examination. It's either in person or online. And if you are interested, like, to sponsor or host credentialing, so our colleagues will be happy to assist you. Just send them a message in the chat box. So there was also a mention of the things that we do that's normally more accessible to our members, such as webinars, workshops, and sometimes we host FGDs. So Ms. Kalsoom mentioned about our webinars, and we want to emphasize that these webinars are actually free for everyone. So not only our members. So this is open to the public, as we want to share and increase, disseminate not only evidence-based policies, but recent development in terms of what we know in terms of substance use prevention, treatment, recovery, as well as information regarding research and other developments. So from March 2024 to February 2025, ICUDDR has conducted 17 webinars with a total of 2,482 registered participants. So this covers a variety of topics, including a series on psychopharmacology, educational standards. We also talked about quality standards, implementation science, some workshops, some stat-related webinars such as Introduction to Mediation and Moderation, and Scoping and systematic reviews. In addition, so we also conducted a 7-series workshop on R, which is an open source statistical software. So this was conducted in August, and we have 209 registered participants for that. So we also organized a focus group discussion on global synthetic drugs with 245 global participants. And these are not only university personnel, but actually some representatives from government organizations. So from Asia, Africa, Middle East, Latin America, and the Caribbean, North America, and Canada. So we also have digital engagement. So we know that sometimes it's kind of hard to participate in our webinar because of the time zone issues, right? Or also a variety of issues, time zones, like work, among others. But a lot of our events are actually, you can access it through digital engagement. So we have YouTube channels, so please follow them. So if you miss a webinar, you can actually review other webinars. So in which we have about over 12,000 views. We also have research materials, training tools, and other resources that you can use either in your classroom to disseminate to your students, like to guide you in your practice. So these are available in our website. So if you haven't followed us in our social media, please do so. So we have Twitter, Facebook, X, LinkedIn, and YouTube. And then we also send a newsletter. So you can join our mailing list. Like if you register for our webinars, even if you are not member, you can still receive our newsletter. Just check you want to be added to our mailing list, and we'll sure that we'll let you know of all the events that would be accessible to you. Now, one of the big events that we host are annual conferences. So these are global and regional conferences. And for the past year, so these are made possible through partnership. So in 2022, we have conducted the annual conference in collaboration with NRC and ISAP, hosted by the Abu Dhabi government, in which 2,000 participants from 125 countries were present. In 2024, it was in another global conference, the one that we have in Greece, in which there are 800 participants from 123 countries. Again, this is in partnership with ISAP. But every other year, we actually have a regional conference. So last year, we have one in Thailand. So in partnership with Chiang Mai University. So we have 444 participants from 42 countries. And for those who are interested, we have an upcoming regional conference in Africa in partnership with Cairo University. If you want to know more information about that, please go to our website. I think you can still register, and it would be a hybrid conference. So we encourage you to participate and attend. And I guess this would be my last slide, but I wanted to, Kevin mentioned about the different centers, and I think this is actually a validation of the good work that ICUDDR is doing. So we have expanded exponentially in terms of the number of work, tasks, and the number of centers that we have from just like more than a year ago. So from a small organization, we continue to evolve and grow. And again, this is made possible because of you. So feel free to reach out to us for any questions, for any suggestions, and we will be happy to assist you. So thank you.
Thank you, Verna. Wow, it is really something to see all of those numbers, and we need your support to make sure that those activities can continue to grow and that we have the platform together to introduce additional activities in the future. And now I'm going to turn it over to Miss Carly Searcy. Carly is formerly a staff member with ICUDDR and has graciously agreed to volunteer with the organization as in the future to continue to support our work. So Carly?
Thank you, Lori. So glad to be here with so many familiar faces and names and new people to meet as well. So I've chosen to stay on with ICUDDR as a volunteer, and that's really how much I believe in the work of the organization, the dedication of the staff, but most importantly, all of you, the members, supporting your work around the world. So you've welcomed me into your countries, you've shared with me with your research, your teaching, and you have all given freely of your time and talents to build healthier communities and a healthier world. And that's why I felt compelled to stay with ICUDDR as a volunteer so we can thrive together. And so I'm here today as a supporter to invite you to support or continue to support ICUDDR. So one of the things that we talk about is financial. So some of us are able to make donations. Certainly we ask people to consider giving as you are able, and I will share other ways to support ICUDDR in addition to the financial support. But what those dollars do for those who have given in that way, they allow us to give direct assistance to the folks that we work with, education to those in need. They also help us to sustain our programs. So those consistent donations especially allow us to maintain and expand our services. And donations help us with our operational capacity. So staff, technology, facilities, so we can maximize our effectiveness. Donations also help us there as leverage for additional funding. So those initial donations help us secure larger grants, and they also help us show your commitment to the organization. So it can be very powerful to say that we received a number of donations from people who gave $10, because that shows that people were digging deep, who really support the mission and the work of ICUDDR. And then the other thing that donations can do is give us those unrestricted funds. When we have unrestricted funds, we get to determine how to use them. ICUDDR gets to determine whether they want to use them to test a new approach to service or respond quickly to an emerging community need. And this is really the reason that I donate to ICUDDR as I'm able to, because I really support that ability for ICUDDR to be nimble and to be able to adapt to conditions. There's also some urgency in terms of support right now. We talked about the government funding shift. So we've got shifts in funding priorities, and we've got some gaps to fill. There's increased demand in services typically for nonprofits. In times of need, in times of having fewer resources, there's often increased demand at that time because there's more need for essential services. And then finally, we have some economic pressures happening right now, which are the rising costs that affect our expenses and again, increase the needs of those we serve. Now, there's more than one way to give to ICUDDR, and I hope you'll think about all three ways. And I think of them as hand, heart, and voice as three ways to create change. So by hand, I mean those donations, giving financial support that fuels our mission, because every dollar creates a ripple of impact. Also, from the heart is volunteering. That's what I'm doing today, sharing my time and talent. And our volunteers make our work possible, really creates meaningful connections within our community. And I want to say that ICUDDR has been a volunteer organization for some time. Our board members volunteer their time. Our regional coordinators have given generously of their time. Folks like Samuel Dakwak to support the Africa region. Verna, before she was a staff member with ICUDDR, gave very generously of her time to support educational events in Asia Pacific. We have a new intern, Cedric, who's on the call with us today. And we have a new student volunteer named Lily. So just many different people coming together to join us. And actually, we have a webpage that outlines the kinds of volunteers that we're seeking right now. We have some really urgent needs in terms of grant writing and fundraising, but also technology support, communication, and more. And we'll get that in the chat for you so you can take a look at that volunteer application. So we talked about donating funds if you're able, volunteering your time and talents. And then the last thing you can do to give to ICUDDR is to use your voice to amplify our cause. And really, today, you're here on this call you're all advocates for ICUDDR. If you're on this call, you're an advocate. And each time you speak up and talk about ICUDDR, each time you share our story, so you're sharing on social media, when you champion our mission, all of those things help us build the momentum that we need for lasting change. So you're helping us to have a future for ICUDDR. And that's really what I think the message is here today, is that this is a beginning, not an end. So we have some financial constraints that we're working through, but this is really a beginning. And I say that because this is a really positive, optimistic group of people. The staff are positive and optimistic, and the ICUDDR members are incredibly positive. And I think that's because you've faced significant challenges before. You've faced political challenges for your work, financial, and you've found ways to change your communities. So thanks to those of you on this call who've already donated, volunteered, and advocated, and I invite others to join the work. And I really want to thank everyone who shared their member stories as well. And thank you all for the important work that you've chosen to do. And I'm going to yield the floor to Verna to share more. Oh, here it is. We have a poll.
So we would love to hear from you. We know, because we work in brain science, that when you commit to something, you are more likely to do it. And so we would love for you to commit. What are you going to do to help spread the word about how important ICUDDR is? How are you going to help us thrive into the future? Will you use your hand, your heart, or your voice? Please share your commitment by selecting one of the choices here on the poll. And I see 16 of you, 18 of you now have committed to helping ICUDDR in the future. We have about 28% of you who've participated in the poll now. We'll give it just another 30 seconds or so. How will you commit to supporting your organization to thrive? Wonderful. About half of you have participated now. 10 more seconds. Okay, Verna, let's go ahead and close the poll and share the results. Are you seeing the results now? Great. Well, I see that many of you, 34 of you, have agreed to advocate for ICUDDR through promoting your events, recommending your organization, supporting initiatives, and staying actively engaged in our mission. And that is so exciting. We need your voice. 33 of you have committed to volunteering, and we are so excited that you want to take part in actively participating in our work, and we'll look forward to getting your membership application through the link that has been shared in the chat and is available through our website. And 12 of you have committed financial contributions, and we cannot tell you how much that means to us. And so we greatly appreciate your support. So thank you all for making a commitment to help your organization thrive into the future. We have, oops, let's see. We could stop sharing the poll, then I think we have just about 5 minutes left. So I'm going to now turn it over to Kevin to provide some closing remarks. And again, thank you all for being here today. Kevin?
Thank you all again for joining us today. Thank you for sharing those, what I would call success stories, or how ICUDDR impacted your work, your life, your university. It's great to have that information and understand that we have a broader reach in a tangible way. Sitting where we sit, we often don't always know that or hear that. we are at a critical juncture. And I just want to add one other piece. When it said financial support, remember, it could also be about an in-kind support, something you thought about that doesn't cost actual transfer of dollars, although those are clearly needed, but also an in-kind contribution on a project that we might work together on. As we heard earlier on in the beginning of this conversation today, about partnering with us. Partnering, maybe you're aware of a grant that's out there or a program or a contract or something, and you want to, with your university, want to partner with ICUDDR and go after that particular project. We're here to help you. We're here to work with you. We're here to partner with you. Again, we do need, and I love the hand, heart, voice analogy for us, because it really is about our members, you all, us together, making a difference in our community. That's the end result of all the work we do, really helping the family member, the individual who might be at risk for substance use, at risk for overdose, who needs treatment, and who needs to get into recovery. Again, that's one of our main missions, is the purpose of helping universities and working with universities to build a system. And it was great to hear about Nigeria and the 4 universities. Know that we are here as long as we can be, and we're shifting our model. You heard where, if you want to volunteer with us, please send us a message. Click that QR code that was there or look in the chat so that we can have you join us as a volunteer as well. We are constantly looking for other ideas and other ways of finding support, whether it's grants, whether it's contracts, whether it's technical assistance provision. If you have ideas at your local level, please reach out to me, out to Laurie, out to Carmel, out to Diana, out to Verna, and let us know how we might partner together, again, to get through this period of uncertainty, because I'm just going to be very, very honest right now. We don't want all that hard work that you saw, that you all did and participated in, to go away, to disappear. The network is built. We don't want it to die. We want it to thrive. Again, I want to thank you for joining us today, joining us this afternoon, joining us this evening. I know we're across the globe here. It is a pleasure for me to have had the time to speak with you. And if you don't mind, I'd like to just, Laurie, leave it for them to ask any questions, comments, ideas, just for maybe 3 minutes, so that I know we're all extremely busy and it's evening time or breaking fast time soon.
Absolutely. This concludes our formal part of our presentation, and we are so thankful to all of you who have joined us. If anyone has any further questions, comments, or ideas, we are happy to stay on the line, as Kevin mentioned, for a little while longer to talk to you. But again, thank you for being here, and we'd love to hear more from you. This is not the end. This is one opportunity, and we're always here to hear from you and answer your questions. Thank you. And if you have anything else you'd like to share, questions, comments, please feel free to unmute and go ahead. Otherwise, thank you for being here, and we'll see you next time.